welcome everybody to the Street Dog Podcast, brought to you by the Street Dog Coalition. We are an international nonprofit providing care for lives on both ends of the leash by providing free medical care and related services to pets of people experiencing or at risk of homelessness. I am your host on today's, I think, going to be really fun and informative call, Daria Tavana, and I'm also the Director of Development at the Street Dog Coalition. And my co-host today is Katrina Weschler. She's the Executive Director of the Street Dog Coalition. Hi, Katrina. How are you?
Hey, I'm great. So happy to be here.
Yay! And if you're joining us live, go ahead, drop an emoji in the chat box, say hi, let us know where you're tuning in from, and don't hesitate to ask us questions or share comments as you feel inspired to during this chat. And I want you to know that on the Street Dog Podcast, we explore the world of animal welfare through the eyes of experts, street dog vets, and volunteers. And we'll share inspiring stories, provide updates on our advocacy work, and give you an inside look at the challenges and rewards of working to improve the lives of animals belonging to people experiencing or at risk of homelessness. And that's exactly what we're setting out to do today. So again, if you're tuning in live on Facebook, it's great to have you. We appreciate your support and we love connecting with you. And if you're listening on Spotify, Apple Podcasts, YouTube, wherever you're listening, please make sure that you're following the Street Dog Coalition on Facebook so that you can also tune in live for every episode. That will give you the opportunity to engage with us in real time, which we absolutely love to do. Okay. I always feel like that opening spiel is so long. But anyway, here we are today. And I'm really, really excited because today we have Dr. Hilary Wheeler, who is SDC's medical director. And we have Andrea Romano, who is our board member. She's also a philanthropist, and she is also the co-team lead for the Bay Area Street Dog Coalition team. So why don't I just let you guys introduce yourselves? You can decide who goes first, and maybe tell us a little bit about your role at SDC and maybe how you wound up working with us here at this organization.
All right, I'll jump in. I'm Dr. Hilary Wheeler, and as Daria said, I am the medical director for the Street Dog Coalition, and so thrilled to be a part of this organization. I actually was introduced to the Street Dog Coalition in June of 2020 as a veterinarian in the San Jose Bay Area in California, and I think I read a story about them and it just immediately resonated with me. I had seen so many people on the streets with animals, and especially in the height of the pandemic, realize that we just needed to do more and wanted to figure out a way I could use my skill set to do more. So it was amazing to hear about what they were doing. Katrina managed to get back to me immediately and tell me that there was a clinic that was going to be starting for the first time ever in the Bay Area. And I went to that clinic, and I think within a matter of a month found myself as the team lead for the Bay Area. That very first clinic was in a parking lot. We were on the ground, on the pavement. We had a few boxes. Just a handful of us were there. Just a handful of people showed up, but it was so intensely emotional because of the time we were all living in and being able to help people and helping their animals. I was on the ride home with my husband and I said, this is what I want to do when I grow up. So it was absolutely amazing. And then Andrea, I'll let her kind of give her spiel, but she actually met me. She brings her animals to me. I'm her veterinarian. So we connected in that way. And I think also in 2020-ish. And she was bringing one of her wonderful dogs to me for acupuncture at my clinic, the Whole Pet Vet, and that's in Los Gatos. And of course, I had to share with her my passion for the Street Dog Coalition. And she just was on board immediately. And next thing you know, she's involved, she's on the board. and she's my co-team lead. And yeah, we work the magic together. So I'm so appreciative to have her on my team.
Well, and I think Dr. Wheeler, Hilary has basically said everything that needs to be said. That's exactly what happened. I got to know her because I started going to her to get acupuncture for my dear sweet Bruno. And I think she was, rightfully so realized that I was simply the same type of animal person she is, and mentioned this beautiful organization. And I got involved, and the rest is pretty much history. And I've never looked back. It's been so lovely, and I've enjoyed it. I've had some great times. We've had some really fun events, both locally in the Bay Area. And I was able to join Katrina at a really amazing event in Chicago last year that I still think about to this day, how cool that event was. So it's been fun, and it's an easy volunteer time for me. I enjoy every second of it. There's nothing about it that ever makes me question anything that goes on. It's just everything is so open and forward thinking and lovely, and it's for the right reasons always. So I love it.
Thank you both so much for that. Katrina, would you like to kind of chime in and share anything before I start asking these incredibly talented individuals some questions? Maybe actually, Katrina, if you could kind of share with us from your perspective, how having both Hilary and Andrea at the helm of so many different, initiatives here at SDC, how has that allowed the organization to evolve, maybe in ways you never expected?
Yeah, absolutely. Well, first of all, I'm so thrilled to have these two as a part of the SDC team in so many ways, more ways than one. I think it really goes to show how strong our organization is, that people start as volunteers and then evolve into so much more. They come to it with institutional knowledge and passion, like an obvious commitment to the mission, but also eager to see the vision, the strategic plan of Street Dog Coalition. They're invested in that, and it means so much to us. I will say that having these two as a dynamic duo in the Bay Area is super helpful. A, because obviously Hilary has become our medical director, and then B, Andrea has become a board member, very active board member. And so they're not just a powerhouse in terms of their ability to help pets and people on both ends of the leash at their street clinics, but they're also a powerhouse in helping Street Dog Coalition grow sustainably. And that's a big thing for us right now, especially. So I love that. And I also really have to say, every team that is able to recruit a co-team lead, we encourage it. I mean, it's like maybe one of the first things Hilary says as, the medical director to prospective teams that hop on Zooms with us to learn more about Street Dog Coalition. It's one of the first things we say, if you can find yourself a co-team lead, it makes all the difference, because we want to make it easy. We want to make this a volunteer job that everybody enjoys, and it's not hard. And it gives them, and I'll let Hilary talk more about this, it gives them that helping high, which is a term Hilary coined after volunteering at a clinic. So yeah, I just think having more people involved and invested, and having a right hand and a left hand like these two is just a game changer.
Yeah, I love that, Katrina. Thank you for sharing a bit of your perspective with us. And as someone who's new to the organization, I can personally see very clearly how exciting it is that the Street Dog Coalition is this real family of volunteers and a small staff. But within that family, there are these incredible power duos, right? And I love that we're looking at a power duo right now. And this is, I think, going to be a really incredible conversation. One of many conversations we will have with Hilary and Andrea on this podcast. So I would love to maybe chat a little bit about, man, there are so many questions I have for you guys, but I would love to kind of maybe get your insight on the power of going local and the power of some of our grassroots initiatives. I think it could be really interesting to hear your perspective, because you guys are both kind of on the ground doing this incredible work in the same or similar geographic location. And I would love to, Hilary, I think we could have a totally different podcast episode where you talk about the helper's high and burnout and all that stuff. But by all means, please weave that into some of these responses. The first thing I would love to chat with you about is, and Hilary, Andrea, chime in, both of you, whenever you feel like you've got something to offer some of these questions. But I'm curious to know how does SDC engage with and involve local communities from your perspective and experience?
Yeah, and I think the great thing about the Street Dog Coalition is we really do embody the concept of think global and act local. And we all hear that. And a lot of people, I think, love that idea, but get a bit paralyzed. Our other term we love is analysis paralysis. So we work hard in our organization to avoid that and minimize that for everyone who's involved. But for me, as I shared, I did feel for many years, I felt a bit paralyzed as to how could I help? And, I had my own form of trying to help in different ways, but really didn't recognize that I had a set of skills that I could channel into helping people by helping their animals. And so the community aspect, when I got involved, realizing that not only could I use my veterinary education and use those superpowers for good, I could actually work with other volunteers who had their own skill sets of whether it was communicating with people, helping with education, helping with support, sometimes just being there to listen and talk, especially during 2020 and 2021, when a lot of the people we encountered and worked with felt alone and felt really neglected and lost and fearful. I remember one conversation, an older couple that shows up every clinic we have. We love them. They have 3 dogs that they love dearly. And the very first time I met them, they weren't sure if they would see me again because they were so fearful of COVID and how they would get through this. And so seeing them at that following clinic, it just deepened that connection. And then since that time, we love welcoming them, and they've told other people that are in their own community of people that are in need of help. And that has allowed us to form those contacts. And volunteering is an amazing way to get involved. I think people get overwhelmed as well, thinking I have to be a veterinarian or I have to, have some specific skill set. And as Andrea was touching upon, she's just an amazing animal advocate and, philanthropist. So for her getting involved, she gets to do the check-in where she's actually talking to people and hearing their stories and being that first point of contact and talking about what we can do to help them. And that to me is all about coming together as a community and working through some of the most difficult circumstances together and feeling that you're not alone. And it actually made me feel better about everything just by making those connections with people. And I found that I could talk forever. Obviously, I'm not going to, but I found that for me, I was struggling. We all were. And we were essential workers as veterinarians, and no one was really talking about that aspect of what was happening during the pandemic. And so for me, going to work every day, you're just doing what you do, but feeling very alone in many ways. And what was so amazing to me is just by meeting people in the community that were really in a state of despair and realizing that I could make a difference simply by helping get their animal up to speed with vaccinations, talking to them about what they were doing right to help keep that animal healthy, and recognizing that bond that they shared and that lifeline with that animal. It actually helped me, and it helped me get through probably one of the most difficult times as a veterinarian. So yeah, I can't share enough how much I love volunteering. And that's what's wonderful about, I'm the medical director now. I get to be part of this organization as we grow, but I still get to be on the ground and I still get to volunteer, and I get to meet other volunteers and meet other people in the community and give them that resource to get involved and to do more to help one another. I'll stop there because I'm sure other people have amazing things to share.
And I can't wait to hear Andrea chime in. I also just want to highlight I have such an image in my mind of that couple that you mentioned that wasn't sure if they were going to see you again. And I think the fact that they did come back and you did see them again is such a testament to something I've witnessed, which is STC's ability to very, very quickly create this trust between the volunteers who are at these clinics and the individuals who need this care for their pets more than anybody else, right? So I just really wanted to kind of pull that out and shine a light on it. It's amazing, especially for me to have witnessed firsthand in Philadelphia, just to watch these individuals who are oftentimes, especially during COVID, marginalized, right, by other groups, and often feel like they have nowhere else to turn to. It's just so deeply rewarding to watch these individuals open up in a matter of minutes at these street clinics. So I'm almost not really surprised that they did end up seeing you again, Hilary, because I'm sure you were able to earn their trust at a time when they were maybe wary of most people. So thank you for that.
They're a lovely couple. And in fact, like Hilary mentioned, they do come to every clinic, and it's even just to have us look at the dogs. They know they may not even need anything. They just want Dr. Wheeler, as the DVM, to take a look at them. But they recently, and Hilary, I don't know if you know this, they finally got into government housing. So they'd been in some kind of transitional situation for quite a while. And through their own perseverance, and then just, being able to, survive through all this process, they've gotten into some good housing that's more stable for them. And also having all of the records that they needed for their pets was also part of the process. So being able to provide the vaccination requirements, proof of vaccination requirements, help them get where they needed to be. So they're in a much more stable housing situation now, which is lovely. And then one of the other things I just wanted to tack on to what Hilary was mentioning is when she first talked to me about Street Dog, obviously I was very intrigued and I was very excited about it, but I was really nervous because I am such a passionate animal person. I thought I'm going to end up adopting everybody's pet because I'm not going to like what the conditions are. And I'm going to be stealing everybody's dogs and cats. And my husband's going to divorce me. It's not going to be good. And she said, actually, no, it's absolutely the opposite. When these animals come to the veterinary clinics, with some exceptions, if there's been an accident or something like that, or a trauma, she said they are very well cared for. They are very loved. And that is one of the key takeaways I've gotten as I've gotten to get to know these people, because I do all the intake and I have to ask them a lot of very personal questions, and they're all very open and honest because we have to do all this pre-qualification. I don't even know this word, but just this pre-registration. And it's clear that these people would not eat first if it meant that their pet had to eat first. And so that is just the most amazing thing. Or they'll come to us very concerned about their loved one, because a lot of times, and especially during COVID, I think it was even worse. This was the only thing they had kept keeping them in touch with that they could live for. So it was a very, very interesting time. It still continues to be an interesting time, but these people, this is their lifeline. And so they live for these animals, and it's very touching to see. It's pretty impactful.
Wow.
Yeah. I will echo that. I mean, the pets that come to street dog clinics are very well cared for, extremely loved, and I think provide purpose, and often are the reason that people are able to take that extra step that maybe was hard before to get that more stable housing or situation. And we do more than just veterinary care. Obviously, that's like the root of Street Dog Coalition. That is our core mission, is to provide this free veterinary care. But whenever possible, we also try to provide resources so people can get out of the situation that they're in. And oftentimes that's just knowing what's available, making connections. We're not all social workers. We don't know everything. But if we can connect, that's our goal. And I think our teams do a great job of that. And that comes back to your question about grassroots efforts, Daria, and sort of, community partnerships. One of our core values is unbridled collaboration, because we know we can't do this work alone. We could try, and we would be able to vaccinate a lot of dogs and provide veterinary care, but we can do so much more when we work together with other organizations already serving this community of pet owners. And I love that about us. I love that we don't recreate the wheel. that we invite others to come to our street clinics. They can provide their services right next to us. And oftentimes that's a hot meal, or it's a medical screening, or a dental screening, or maybe they just want to come and provide free pet supplies and pet food, which is always welcome. So I just love the unbridled collaboration that happens at Street Dog Coalition. And I credit all of our volunteers and our team leads for making those connections, because they happen really organically and beautifully. And they also are going to lend to more One Health efforts down the road, which is an ultimate goal of ours, is to really provide more care for both ends of the leash whenever possible, without adding more work to anybody's plates. If we can just make those connections, invite other people to come, make it easy, that's the goal. And I think when somebody feels like they can trust an organization like we do, another one of our core values is trust. If they trust us with their pet, they might be more willing to trust other people with their needs. And that's a goal. So yeah, I love that about us. And I love that we have amazing volunteers like this who make it happen.
And, just to add on to the, we all hear the term One Health, and I think it becomes so nebulous. It's difficult for people to grasp what that really means. And we know it is this interconnection that exists between humans, animals, and the environment. And what's so amazing about SDC is, as Katrina pointed out, we really do make these grassroots networking resources with other people. And sometimes it's happened all organically, at least for us in the Bay Area. Our first clinic, it was a church that allowed us to use their parking lot. Going forward, it was a group called Street Life Ministries that started showing up and providing meals. And we were there to take care of the animals. And we cover, the Bay Area is a huge area. We cover a lot of different areas. And what I love is we've been able to meet so many people in the community that are doing so much. And that's really something I had no idea that these organizations existed. And so being able to form those relationships and actually connect one another so that we could contact a group and say, hey, we've got a family that needs help with finding housing resources, or we've got a family that needs help with finding day shelters for use for showers, or whatever the case may be. And we've been able to find groups that can facilitate that and provide that. And our goal is always to network with human health practitioners at some point, whenever that's possible. And so, just recently I met someone who is a social worker and her husband's a physician, and they want to get involved. So it's great. What I find is I get so passionate talking about it, I reel people in, and then I meet equally incredible people doing incredible things in the community. And that's really our goal, is let's all work together and do the best we can to do more good. And, the whole unconditional love, another one of our core values, is really what opens up those doors and allows us all to not just work together, but to get the trust of these people. A lot of them will not accept help if it's from a human health standpoint. There's a lot of understandable mistrust, and being able, and there's trauma behind that, and being able to just step in and say, hey, no judgment. We're here with unconditional love to help you and help you better help your animal. And that there's your doorway right there, is just by accepting them, taking care of their dog or cat, a rabbit. We had a potbelly pig. I mean, we get them all, but being able to make sure they understand that we are appreciative and recognize that bond and everything they're doing. Many times they will then be accepting of other resources and other forms of help. And that's really what it's all about. So that to me is absolutely one of the big things that drew me to Street Dog Coalition.
Well said.
I love that. Thank you so much, Hilary. It's really incredible to hear your side of the story, what drew you to the organization. And I think that what you've highlighted is something that's so unique about about the Street Dog Coalition. I am an animal lover. I love people too, but I really love animals. And I have to say that what is deeply inspiring and exciting to me about the organization is the intersectionality of the work that we do. How we truly are caring for lives on both ends of the leash. And our work doesn't stop with animals. I think if anything, it kind of starts with these animals. And I think we've done a really great job at using our relationship with these animals to improve the lives of the owners of these animals in ways that maybe they never even thought possible. And I want to kind of maybe bring this conversation back around to Andrea before we hop off and end things. And I know Andrea wears so many hats like everyone on this call does. And one of the many things I love most about Andrea is man, she really puts her money where her mouth is. And she has done so much for us, both from a leadership perspective and from a board perspective. But as you know, you may or may not know, Andrea is also an incredible member of our donor community. And I'm curious to know, Andrea, if you could maybe tell us just a little bit about why you donate to the Street Dog Coalition. And if anyone is considering donating to the Street Dog Coalition here, what advice you might have for them?
Mm-hmm. Well, obviously, I've got the benefit of seeing behind the kimono of everything that happens, and we're certainly very transparent. The bottom line for me in terms of donating is I know exactly where the dollars are going. There's no concern ever. And there wasn't even before I got involved in like diving into the board position. There was never a concern about, oh, is my money being used how I would like it to be used? And so in my mind, you know, we've got a very low, as just a general donor, the overhead that we realize as an organization is very low. And I know that the rest of the dollars, once the overhead is accounted for, is being used exactly the way it needs to be used. And so it's a great benefit to us as an organization, because the other thing that the organization has given the other teams is a little bit of autonomy in being able to spend the dollars the way they need to spend them for their region. So for example, we have an organization that's based out of Chicago. That particular veterinarian needed storage space, and we're like, get a storage unit. And there was never a question. There's no administrivia involved with that. It's like, there's a need, get it, because she had no place to store all of this stuff that she was trying to like get in and out of, like a church or something, I think, that was closed off at periods of time. It was just not working for her. And she's a one-woman show. Of course she is. She's amazing. And so that was great. And even in the Bay Area, we've had a few situations where maybe we've had to give some additional care to animals that we can't handle in the field just for whatever reason. And so we know that if we find a veterinarian that we can get that animal to, we can pay for that with the funds that are designated for Bay Area or ones that are provided to us from SDC Global, I guess is the word. So I think just as a philanthropy perspective, again, just the bottom line at knowing that the dollars are being used for the organization and not to pay people's salaries or some there's no flying around in jets. There's nothing weird going on. And I can tell you, like, I've, obviously as a donor, I'm sponsoring certain things because you guys are so frugal, like you don't even want to spend money. I'm like, I'll sponsor that. Right. So I think that's awesome. And so again, if anybody's thinking of donating, whether it's $1 or $100 or $1,000, just know that that money is absolutely going to be used to help further the mission.
Yeah.
Yeah.
Thank you so much. I want to tag on and just say every donor means the world to us. And I love that Street Dog Coalition has such a diverse portfolio of donors right now. People that have given a couple dollars here, a couple dollars there. Maybe they spread it out and they're monthly donors. Maybe they give one big gift a year. And it just means so much to us, but also to everybody that we're helping. And they know that this is fueled by people who care. And I feel like that extends to them. Like they feel you caring for them. And I love that about our donor base. And I also want to say that we have two incredible legacy sponsors that really make this work possible. The reason so much of your donation goes directly to care for people is because we're able to use a lot of our operational budget to pay for kind of the overhead, thanks to Western Veterinary Partners, thanks to Merck Animal Health. These two organizations have become legacy sponsors because they have made a huge commitment to us to not only provide all of the medical, supplies for the most part from Merck Animal Health that we need, to provide the vaccines at our clinic. But then there's Western Veterinary, who is making an annual donation in addition to getting their hospitals involved. We're talking about doing $1 addition to your invoice, and people can opt out if they want, but they're inviting people to just add $1 to their bill, and that will go to the Street Dog Coalition. And that $1, and I don't know how many hospitals do they have, 160 across the United States. If every one of their paying, patrons gives $1, that adds up, and it's just going to make such a huge impact. So shout out to our donors, shout out to our sponsors, shout out to our volunteers, because they run this. I mean, we're here like kind of orchestrating things, but really they're running the show, and we're so grateful to them. So it takes a village. Everything, it goes back to the unbridled collaboration. Honestly, we couldn't do it without everybody being invested and committed.
And it's a lot of work to volunteer. So I mean, obviously, if we wouldn't do it if it wasn't something that we could see the fruits of it happening, because there's a lot of commitment here that we have to do, especially as the team leads and as the medical director. And obviously it's she's working very hard. And so if we didn't see the fruits of our labor, it wouldn't be, we wouldn't be sitting here right now saying how wonderful this organization is. I mean, we are absolutely seeing the impact it's making. And that's what gets me up in the morning to get on, to do stuff for STC. It's fantastic. So it's very cool.
Yeah, and just to share a quick local donor story is one of my neighbors. We've been renting in the same neighborhood for 13 years, and she and her mother they used to live next door. Her mother's 97. She's in her 70s, obviously fixed income, and she plays the lottery.
Oh.
And she's got the magic touch. I mean, every time I see her, I'll be walking my dog, and I always stop by her house because she loves saying hi to my dog and me. Probably more so my dog, but that's how we all are. But she every time says, "Hilary, I wanted to tell you I played the lottery and I got $50 or $100 or $200. And every time she writes her check and sends it in and makes a donation. And it's just, and of course I say, save some for yourself, but it makes her so happy, and it makes me so happy. And every weekend when I know I'm going to have time to walk around the neighborhood, I just look forward to seeing her and hearing her story. And she's so excited to be involved and to know that what that money is, it's going directly to the work we are doing in the community. And it's just great. Every time she just has the same level of passion and excitement when she tells me her story and then shares that with the Street Dog Coalition.
That's so beautiful, Hilary. Wow, my face hurts from smiling so much, truly. And I love, Katrina, that you mentioned it takes a village, because it does. And I think there are so many different roles within this village, and a new role is the individuals who are tuning in and listening to us live here on Facebook or listening to our podcast. And we actually have 2 comments from supporters that just came in. One is from Christine, who I actually happen to know very well. She's one of my best friends. And she said, "San Diego checking in. So grateful for what you're doing for our community. Thank you for all that you do." So thank you, Christine. And Scott, we have another comment, says, "What a terrific team. You folks are the best. Thanks for all that you do in orchestrating all of this. So there you have it. 2 members of our village tuning in live, telling us exactly what the Street Dog Coalition means to them. And I want to encourage, anyone who is listening to this episode, if you feel so inclined, I will add the link to our show notes as well. Feel free to make a donation of $1, of $10, whatever works for you really works for us. And I think you heard it best here from Katrina, from Andrea, from Hilary. We put your dollars to work immediately, and the money that you donate to us really does make a huge difference, not only for pets of people experiencing homelessness, but of course for the individuals themselves who are in love with their pets and who take, I think, incredible care of them, which we all kind of talked about a little bit earlier in this episode. So, man, this conversation was incredible. You guys, if I don't let you go now, I will keep asking you questions for another 3 hours. So I'm really, really glad that we got to check in with one another and to share a bit more about what Hilary and Andrea do here in the Street Dog Coalition family. And Katrina, an amazing co-host as always. I am going to say goodbye to you all for now. But again, if you're listening and you want to support our work, keep listening to our podcast and head on over to our website and make a little donation. We would really, really appreciate it. And we promise to keep you updated on all that we are doing with your financial support. So thank you guys for tuning in, all of our listeners. And thank you, Katrina, Hilary, Andrea, for taking time out of your very busy volunteer schedule to join us today on the Street Dog Podcast.
Thank you, Daria.
Thank you, guys. Take care.
Bye, everyone.
Bye-bye.
Hey.